This is the condition that affects nearly 84 million American adults, stops their breathing hundreds of times every single night, and roughly 80 to 90% of them have absolutely no idea they have it. This is the complete science of obstructive sleep apnea. Every time you fall asleep, your muscles naturally relax. That's supposed to happen, but for 1 in 3 American adults, that relaxation triggers something dangerous. The muscles in their throat go slack, surrounding tissue collapses inward, and the airway pinches shut. Breathing stops, oxygen levels plummet, then just before the situation turns fatal, your brain fires off an emergency signal, a survival reflex that jolts you awake just enough to gasp for air. You probably won't remember it in the morning, but it happened, and it happened again and again. In severe cases, this cycle repeats once or twice every single minute, hundreds of times in a single night. That is obstructive sleep apnea, also known as OSA, the most common form of the condition, but it is not the only one. There are 3 types. Obstructive sleep apnea accounts for most cases, and it involves the physical collapse of the upper airway. Central sleep apnea affects roughly 0.9% of adults globally. In this form, the airway is not blocked at all. Instead, the brainstem breathing pacemaker simply fails to send the signal to breathe. The third type, mixed or complex sleep apnea, combines features of both. To understand why obstructive sleep apnea happens, you need to grasp 4 key factors about the upper airway. First, some people simply start with a narrower, more crowded, or more collapsible airway. Anatomy matters. Second, the pharyngeal dilator muscles, especially one called the genioglossus, should keep the airway open during sleep. In people with obstructive sleep apnea, these muscles do not do their job effectively. Third, the airway naturally narrows during sleep, even in healthy individuals, but in obstructive sleep apnea patients, that narrowing crosses a critical threshold. Fourth, some people have what is called high loop gain, meaning their breathing control system becomes unstable. It overreacts to small changes in carbon dioxide, creating a cycle of overbreathing and underbreathing that destabilizes the airway. Here is what unfolds at the molecular level during an apnea event. When the airway collapses and breathing stops, carbon dioxide begins accumulating in the bloodstream. Chemoreceptors detect the rising carbon dioxide and send alarm signals to the brainstem. The brain triggers a microarousal, just enough consciousness to restore muscle tone and reopen the airway. You gasp, oxygen floods back in, carbon dioxide drops, and you fall asleep again. The whole event can last 10, 20, 30 seconds, then the cycle starts over. You might think losing a few seconds of breathing here and there cannot be that serious. You would be completely wrong. Each time this happens, the body releases a surge of epinephrine and adrenaline, the same stress hormone you would produce if someone jumped out at you in a dark alley. Over months and years, these repeated adrenaline surges cause high blood pressure. They damage the lining of blood vessels. They raise LDL cholesterol and other harmful blood fats. The result is a cascade of cardiovascular destruction. Obstructive sleep apnea increases the risk of heart failure by 140%, stroke by 60%, atrial fibrillation by 200%, and coronary heart disease by 30%. In patients already dealing with cardiovascular conditions, obstructive sleep apnea prevalence runs between 40 and 80%. Research from the National Institutes of Health found that for every measurable reduction in blood oxygen levels, a person's risk of a primary cardiovascular event increased by 45%. The damage doesn't stop at the heart. Sleep apnea has been linked to Alzheimer's disease through increases in beta amyloid protein and white matter damage in the brain, both hallmarks of neurodegeneration driven by chronic sleep disruption. It contributes to type 2 diabetes, depression, and a dramatically higher rate of motor vehicle accidents. The National Safety Council estimated that 810,000 car collisions and 1,400 fatalities in the United States were attributable to sleep apnea in a single year at a cost of nearly $16 billion. The total economic burden is staggering. The American Academy of Sleep Medicine calculated that undiagnosed sleep apnea costs the United States approximately $149.6 billion annually. That includes $86.9 billion in lost productivity, $26.2 billion in motor vehicle accidents, $6.5 billion in workplace accidents, and $30 billion in increased healthcare costs. If left untreated, patients with obstructive sleep apnea rack up 2.5 times the healthcare costs of people without obstructive sleep apnea, and yet 80 to 90% of people with this condition don't know they have it. The story of how we came to understand sleep apnea is surprisingly recent. The earliest literary description came from Charles Dickens in 1836, who wrote a character known as Fat Joe in the Pickwick Papers, a markedly obese boy who kept falling asleep uncontrollably on his feet. By 1889, doctors were using the term Pickwickian to describe excessively sleepy patients, but it was not until February 1966 that French neurologist Henri Gastaut strapped electrodes to a patient with Pickwickian syndrome and documented the actual breathing pattern, the repeated apneas during sleep that would eventually define an entirely new field of medicine. This technique became the foundation for modern polysomnography, the gold standard sleep study used to diagnose obstructive sleep apnea today. Even then, recognition crawled forward slowly. Sleep apnea was not widely acknowledged as a public health problem until the 1970s. The real breakthrough in treatment came in 1981 when Australian physician Colin Sullivan invented CPAP therapy at Sydney University. His work led to the founding of ResMed, now a major medical device company. CPAP, continuous positive airway pressure, remains the gold standard treatment today. A machine gently pushes pressurized air through a mask to keep the airway open during sleep. It works, but there is a problem. About half of people prescribed CPAP do not stick with it long term. Adherence rates range from just 25 to 50%. People find the masks uncomfortable, claustrophobic, or simply ineffective for their symptoms. That's why recent developments have been so significant. In 2014, the Food and Drug Administration approved the Inspire hypoglossal nerve stimulator, an implanted device that electrically stimulates the nerve controlling the tongue muscle to keep the airway open. Studies showed a 68% reduction in apnea events. In August 2025, the Food and Drug Administration approved a competing system from Nyxoah called Genio. And then came the biggest headline of all. On December 20th, 2024, the Food and Drug Administration approved Zepbound, the weight loss drug tirzepatide made by Eli Lilly, as the first ever medication specifically approved to treat obstructive sleep apnea. Dr. Sally Seymour, a Food and Drug Administration official, said that today's approval marks the first drug treatment option for certain patients with obstructive sleep apnea and called it a major step forward. There is more on the horizon. A company called Apnimed is developing an oral medication called AD109 that combines two drugs to directly stimulate the muscles that keep the airway open. Their large clinical trial showed striking success, and they are aiming for Food and Drug Administration approval by early 2026. These treatments matter because this problem is only getting bigger. Projections published in the Lancet Respiratory Medicine estimate that by 2050, obstructive sleep apnea will affect nearly 77 million American adults aged 30 to 69, a 35% increase from 2020. The growth will be disproportionately higher among women. Globally, roughly 1 billion people between 30 and 69 already have it. Julie Flygare, president of Project Sleep, said it plainly. Too often, obstructive sleep apnea is brushed off as just snoring, but it is far more than that. The cardinal symptoms are known as the 3 S's: snoring, sleepiness, and a significant other reporting that you stop breathing. In men, a neck circumference greater than 16.5 inches serves as a useful predictor. People over 65 are twice as likely to be affected, with roughly half having at least mild sleep apnea. A body mass index over 30 significantly increases risk, and doctors often use the Stop Bang questionnaire as an initial screening tool before ordering a formal sleep study. This is a condition that silently damages the heart, the brain, and the blood vessels of tens of millions of people who think they are simply tired. The science is clear, the treatments are advancing, the only missing piece is awareness, and now you have it.